Good afternoon. My name is Jeff Klein, President of the Washington County Commissioners. We are now 9 months into the fight against COVID-19, and the virus is still very much a concern in Washington County. While a vaccine is right around the corner, citizens must remain vigilant during the holidays and leading into the winter months. This is a critical time for us to help stop the spread of COVID-19 in our communities. We urge every citizen to wear a mask, wash your hands, and watch your distance. If you or a loved one is feeling sick, please stay home and get tested. Today we have several different officials joining us to talk about where we are with COVID-19 in Washington County. Updates will be provided on vaccination, distribution of vaccinations, current statistics for the county, and how to be safest during the holiday season, the county's response to the pandemic, CARES Act distribution funds, and an update from Meredith's Health. Before I turn it over, on behalf of the Board of County Commissioners, we would like to thank all the essential workers and county employees who have been tirelessly putting in extra hours over the past 9 months. Your service does not go unnoticed, and we thank you for your hard work and dedication for helping to serve the citizens of Washington County. A heartfelt thank you. I would now like to turn it over to Washington County Health Officer Earl Stoner. Thank you very much.
Thank you, Commissioner Klein. As we continue to navigate through the dark waters of this pandemic, just wanted to bring everybody an update on some of the key things that Commission President Klein brought up. Currently, from a cumulative perspective, confirmed cases here in Washington County are 6,238, and sadly, 98 deaths. Overall, the age groups that are most affected within our case distribution is 50 to 59 at about 17% of our cases, 20 to 29, and 30 to 39 respectively at about 14% of our cases. These respective age groups make up about 45% of our total cases. And the distribution of gender is about 50-50, evenly split. So the good news is that there's hope on the horizon. As many of you are aware, the Food and Drug Administration authorized the use of the vaccine developed by Pfizer and is set to discuss the authorization of another vaccine made by a company called Moderna. That is set for December 17th. With this authorization, we should feel very confident that the vaccine is safe and effective. I understand there may be some skepticism out there, and of course that's only natural. However, and I repeat, however, know that this authorization is based in science. Rigorous scientific study, thorough clinical exams, and reviews by the top scientists in our country have taken place to ensure that these vaccines are safe and effective. Of particular note, the process was open and transparent and included public input. The determination as to the vaccine being safe and effective was made by an independent board, independent committee to the the FDA. Pfizer and Moderna in their phase 3 trials each had 44,000 and 30,000 participants respectively, and none, I repeat none, of those individuals reported any serious safety concerns. In addition, the trials included an additional 2-month safety review period, kind of one of those just to make sure types of things that was built in. And also, the speed of development of the vaccine, which is has a lot of people questioning, is due to really the extraordinary advances in vaccine development and technology in concert with a global effort to come together and to really try to speed us through and as safely as possible get us out of the pandemic. As with other non-COVID vaccines, such as the flu or childhood vaccines, some people may experience side effects. This is only natural. It actually shows that your immune system is working. The side effects noted in the research specific to Pfizer are fatigue, headaches, muscle joint pain, especially at the site of the injection, and the potential for a low-grade fever. The evidence shows these last for about a day. So again, it is critical to understand that mild side effects from vaccines are not uncommon. We experience them all the time. The key is to weigh the temporary discomfort over and against the long-term benefits. In this case, a high level of protection from a disease that has significantly, and I can't underscore that enough, significantly disrupted our way of life and caused considerable illness and deaths. We tolerate discomfort in other aspects of our lives every day. For instance, people that like to exercise, go out, engage in strenuous exercise, and have sore muscles. And if you're not like me, most people don't say, well, I'm never going to do that again. So again, people go out, people do exercise, people have sore muscles, they work it out throughout that day or the next day, and they repeat in that activity. So again, I can't stress enough, a little bit of discomfort for the benefit of these vaccines is what we all need to be focused on in moving us through and getting us truly out of this pandemic. Being vaccinated is a very important public service, and high vaccination rates, as I just said, are an absolutely critical factor in moving us through this. Also, to dispel some misinformation that's been circulating, the vaccine can't give you COVID-19, so you can't become infected from being vaccinated. It doesn't contain any live virus. And the vaccine does not contain any microchips or tracking device or anything of that nature. It's a plain old vaccine. The vaccines are going to require 2 doses that are 3 to 4 weeks apart. With Pfizer's vaccine, it's roughly about 2 weeks, and with Moderna's, it's probably going to be about 3 to 4 weeks, during which you are not going to be fully protected. I think that's an important topic to bring up, that it really is, from proven and from a scientific perspective, 2 doses to be fully protected. Sure, after the first dose, probably about 52 to 60% immunity, but you really need that second dose or almost that booster dose to get you to the full protection, that over 90% effectiveness that's being talked about. So like other vaccinations that you may get, as I mentioned, you are not going to be fully protected, so it's going to be very critical that when you are vaccinated, that you still continue to mask, distance, and wash your hands. Preferably, don't go out in gatherings, and basically do everything that you've been doing thus far. So we have been aggressively planning through the EOC and with the county and partners for distribution of the vaccine. We're proud to partner with Meritus Health for administration of the vaccine, which could begin as early as this week. As determined by the Maryland Department of Health and their COVID-19 vaccination plan, Washington County is going to follow a phased approach. We're going to have initially very, very limited doses of the vaccine. So those first doses that roll out are going to go to the frontline healthcare staff, as well as nursing home staff and residents. As subsequent doses become available, at the direction of the Maryland Department of Health, populations with the highest risk of developing complications from COVID-19, as well as frontline workers and essential workers, will then gradually gain access. The Maryland Department of Health plan outlines basically a 3-phase approach. The first and second phases targeting vaccination of critical populations at highest risk of developing complications and those that are in critical industries. So even further breaking this down, phase 1A is healthcare workers, long-term care residents and staff, and first responders. Phase 1B, people at significant risk of a serious illness. Phase 2, people at moderate risk for severe illness, and also people in critical essential infrastructure roles, or in essence, essential workers. And then phase 3, the general public. Movement to each phase, again, will be determined by the Maryland Department of Health using targeted metrics such as vaccine supply and how many individuals in the current phase have been vaccinated thus far. So while everyone will eventually have access to the vaccine, it will take time, and it's going to require all of us to be patient and work together. Adding vaccines to this fight against a formidable foe, such as COVID-19, should be very, very energizing for us all. This is a good day. This is a monumental day. After Governor Hogan announced the first confirmed COVID-19 cases in Maryland on March 5th, county government acted swiftly and activated the Emergency Operations Center. The Emergency Operations Center, or EOC, as it's called, continues to coordinate the county's response to this public health emergency and is working in close coordination with the Maryland Department of Health, the Maryland Emergency Management Association, Meritus Health, and other state and federal partners. Critical objectives of the EOC have been establishing a unified incident command structure that enables effective and efficient response management, establishing plans to address COVID-19 related needs, namely hospital surge, testing, and recovery, and implementing a process to coordinate and manage resource requests, such as PPE, and lastly, establishing a joint information center that provides timely, clear, and consistent information to the public, stakeholders, and to the media. Because of this coordination, we have accomplished much in critical areas. Testing. Despite demand, testing capacity remains robust here in our county. Meritus Health administers the largest percentage of tests, while the health department and other community providers provide supplemental support in that regard. The health department provides drive-through and walk-up services, and a few of the community partners that we have also provide some supplemental testing through their practices. Testing volume is about 141,519, which is about 8th highest in Maryland. And again, robust testing is sort of the linchpin to really the response, and it leads into the next highlighted area of contact tracing. We developed, at the sort of first sign of cases that we were going to have here in Washington County, a comprehensive tracking and tracing program in coordination with the Maryland Department of Health. In addition to the 6,238 positive cases that we've had, there have been 9,185 contacts managed through this program and put into quarantine and linked to other services. There have also been, since the start of the pandemic, 125 outbreaks investigated, and currently 52 of those are still open investigations that the health department is conducting. Hospital surge readiness is another area. Meritus Health has in place a comprehensive system for medical evaluation and care as the limits of normal capacity is stretched. This includes and is highlighted by the newly opened Regional Infectious Containment Unit, which is a 20-bed negative pressure and ventilator capable unit. PPE, the EOC continues to distribute needed PPE to first responders and other community organizations. This has included 214,000 pieces of PPE, mask, and the like, 3,497 bottles of hand sanitizer, 2,651 containers of disinfecting wipes, 255 gallons of disinfectant or bleach, and 139 digital thermometers. Another highlighted area, the Joint Information Center, has coordinated two very comprehensive and community-wide campaigns. This is a Hero mask campaign and the Threads of Hope behavioral health campaign. And then lastly, on the achievement list, so to speak, is the economic recovery through the Recovery Support Function 2, which we will hear more about when Mr. Downey comes up. So, even with and despite all of these accomplishments, the transmission of COVID-19 remains a significant threat to the health and safety of all Washington County residents. No one is exempt. The anticipated fall and winter surge is here, it's real, and it's hitting us very hard. Cases, hospitalizations, and deaths have risen sharply and are at record highs. There has been a 163%, you heard me right, 163% increase in cases just since November 1st. Again, since November 1st, there has been a 109% increase in deaths. So 163% increase in cases, 109% increase in deaths just since November 1st. Our positivity rate is 12.8%, which is fourth highest in Maryland and our highest since April 14th. And our case rate is 81.6, which is third highest in Maryland and highest ever for Washington County. From a comparative standpoint, on November 1st, the positivity was 3.7% and our case rate was 13.9. Additionally, we continue to experience, as I mentioned, a high number of outbreaks and clusters throughout the county, not in one particular area, not one particular industry or sector, all throughout the county. As I mentioned, 42% of them are currently being investigated, and there have been a total of 125. The biggest factor, unequivocally, related to new cases locally has been and continues to be gatherings. So simply put, the virus is everywhere in the community and is spreading at a very high rate. It's straining our healthcare system and leading to unnecessary hospitalizations and deaths. Without a doubt, this is the worst spot that we've been in since the start of the pandemic, and only now are we beginning to see the effects of Thanksgiving, with yet another holiday season fast approaching. With so much of the virus around us, things that seemed relatively safe in August or even in early October are much, much higher risk currently. We need to fight against the sense of complacency and double down on our efforts. We certainly want everyone to have a happy holiday season, but we also want everyone to have a safe holiday season. The absolute safest way, moving into the holiday season, to celebrate the upcoming holiday is virtually or with members of your immediate household. Gathering with people outside of your immediate household, even extended family, increases your risk of getting and spreading COVID-19. However, if you're adamant about seeing others, which I do not recommend, don't travel, keep it small, keep it outside, wear a mask, and physically distance. I understand these measures are an additional sacrifice, especially around the holiday season, and everyone has already changed so much of their daily lives, but these are sensible steps that are necessary to keep people safe and, frankly, to keep people alive until the vaccine is widely available. This doesn't mean that we cancel the holiday season by any means. It simply means we celebrate in a more reasonable way. It means we must respect the virus and take the threat seriously, knowing that it poses a significant risk to our ability to keep Washington County safe and open. There are many ways to celebrate the holidays with loved ones without gathering. Maybe not as fun, but there are ways. Decorate your home or your yard, share a virtual meal with extended family and friends, host online parties or contests, prepare meals and deliver them to family and friends, participate in drive-by events where everyone stays in their vehicle. Again, maybe not as fun, but definitely safer than the other alternatives. The CDC has also issued guidance on how to celebrate at cdc.gov. They have full guidelines that you can go on and view. So again, pandemic fatigue is real. We all feel it. I feel it, just like anyone else. The frustration is understandable, but the next few months are absolutely critical in our fight against this deadly virus. In the spring, we listened to public health and medical experts. We flattened the curve and we saved lives. Now we must call upon that sense of energy and unite again for a common goal, which is to protect our families, our frontline workers, and our small businesses. We cannot afford, on the eve of a safe and effective vaccine, to further overwhelm our healthcare system with a holiday surge of cases and hospitalizations. In closing, I'd like to again thank the dedicated professionals for their tireless work responding to this crisis. Additionally, I would like to thank everyone in the community for your cooperation your patience, and for doing your part to keep your family and the community as safe as possible. Stay united and do the heroic thing for your family, for your friends, for your neighbors, for your community. Please, please, please follow the science. Cancel non-essential gatherings, wear a mask, wash your hands, and get vaccinated when you can. This is important because every one of us can make a difference. Thank you. And with that, I will ask Interim County Administrator, Mr. Kurt Downey, to come up.
Thank you, Earl. Let me begin by expressing my appreciation on behalf of our community for your leadership and guidance during these extraordinary times, and the dedication and the hours that you have put in to keeping us informed and providing sage guidance as to what we can do to stay safe. So on behalf of the citizens of Washington County, thank you. And I also want to thank our emergency manager, Tom Brown, for all that he's been doing throughout this pandemic to provide leadership and make sure that necessary services continue to be provided to our citizens in our community. To all of those working in the EOC and who have worked in the EOC since March of this year, thank you for your efforts. As Earl has told you, your efforts have kept our community safe, have allowed us to prepare plans so that we can minimize the impact this has on the public health, and to provide contingency plans when we need to do so. So again, on behalf of grateful citizens of Washington County, thank you to all of those who have been working in the EOC and the Joint Information Command for providing information and guidance throughout this unique time. One of the things I wanted to report on today was how the community has spent the CARES Act funding that we received from Congress. As you know, Congress passed the CARES Act back in March. We were notified in May that we would be getting $13 million, $13.18 million in CARES Act funding. And in addition to providing regular governmental services on a daily basis, we also had to determine how these funds could best be used to support our community and our businesses. I want to report together that of the $13.18 million in funds that were received, $8 million was used for the Together We Rise program. That was a grant program to our small businesses and restaurants that helped to keep them afloat during this time when many businesses were shut down. We also received from the state of Maryland additional restaurant relief in the amount of $459,000. That was also provided to our local community restaurants. Together We Serve grant program provided approximately $400,000 to local nonprofits in the community. Again, they were hit very hard by the circumstances this summer and saw resultant decreases in revenues. The Community Action Council has provided $466,168 in direct assistance to local residents to help with rent and utilities. Municipalities and Washington County received public health cost reimbursement in the amount of $400,000. This is reimbursement that is going to your local fire and EMS companies to provide them for wages that they have expended during this crisis and helping to keep us all safe. IT enhancements have received approximately $1.2 million to allow for more teleworking during this crisis. There's been $500,000 spent in support of the tourism industry here locally in Washington County. And finally, public safety wage reimbursement has received $1.6 million. That's to the fire EMS companies in Washington County, the county itself, and our municipalities. I want to point out that if you go to the Washington County website www.washco-md.net. You will see a page regarding vaccines. It will provide information regarding vaccinations as well as the vaccination strategy. There's also a survey there that we would ask you to complete regarding the vaccine. Finally, I want to thank our employees here at the county who have worked through this crisis and continue to work through this crisis to provide the essential governmental services that we all rely on every day. I want to thank the essential personnel who have worked at fire and EMS companies through this crisis to keep us safe. Those who work at Meredith, at nursing home facilities, at testing facilities, through this time of peril. Thank you for all that you're doing to support the county. And finally, I'd like to thank the public for staying informed, for taking this seriously, and for following the guidance that Earl has provided. Please stay home when you're sick, wear a mask, and follow the guidance that is being provided by local, state, and federal authorities. Thank you. It's now my pleasure to introduce the CEO of Meredith Health, Dr. Malik Joshi, to the podium. Malik?
Good afternoon, everyone. Thank you very much, Kirk, and I also want to thank Earl Stoner and the incredible leadership of Washington County. We are blessed to have people and leaders who care about one thing, and that's to take care of this community. And so Meredith Health is just indebtedly grateful to the county and the leadership, especially to Earl and the Department of Health. This is a joint effort. This is a partnership, and we're here today because of all of our hard work. So I want to just say thank you. So Earl did a great job in telling you the summary of where we are with COVID-19. Let me give you a little bit about with the hospital. And it is serious. You've heard this word many times, but I can't emphasize it enough. Testing is a public health core. We've been at it together. We've done almost 80,000 COVID-19 tests just at Meredith's Medical Lab. It's almost 60,000 at our one site on Creighton Boulevard. We will continue to do that because we know it's critical to identify and then do the follow-up as appropriate. Treatments. There is no cure for COVID-19, but we are having the ability to provide all the cutting-edge treatments that are available out there, including most recently, we have launched a regional infusion center at Meredith Health. So the regional infusion center allows newly diagnosed individuals with COVID-19 to get an infusion for 1 hour with an antibody, a BAMLAN monoclonal antibody. This antibody has been authorized by the FDA as a test experiment, but is being used all throughout. We're one of 5 regional infusion centers in the state of Maryland for Washington County and Frederick County. So we're seeing almost 10 patients a day there, and that'll soon get to 20 next week. Please visit our website, but it's a treatment that we're all using. Hospital surge. So today, we have almost 100 COVID-19 patients in the hospital. That includes 15 in the ICU. That is significant, knowing that for months, we never got above 15 COVID-19 patients in the hospital. So we're handling it, and we will do it together as a county, but it is stressing the system. And it's stressing our healthcare heroes, quite frankly. Despite their fatigue, we've been at this for 9 months. Despite the fatigue and the pandemic that we're all feeling as citizens of this county, they're taking extra shifts. They're rising to their call of duty. We're hiring additional nurses and staff through agency and other temporary support. Non-clinical individuals are providing support as well on the patient care units and floors. And again, it's an ongoing effort. Our number one is not the beds. We have the beds. It's having the staff to take care of all the patients in our community. The peak is still coming. The vaccine is coming, and there's tremendous hope. But we can't forget, we are still at a high level, and it will continue. And we must do the 3 W's, of course. Wash your hands, watch your distance, and wear a mask. So with hope is the vaccine, and we will be deploying that as quick as possible. Those should be arriving any day. We have allocated in just this first wave 975 vaccines for healthcare workers in the highest risk areas. As you can guess, that includes our emergency room, our intensive care units, our hospital floors that have COVID patients, clinical and non-clinical staff supporting those areas that come in contact or near COVID-19. That's actually more than 975 vaccines. So we are prioritizing and quickly ready to get to the next level once more vaccines are available. Again, we're thankful to have the partnership with the Department of Health to make this work. And as we expand, we're ready to do that, and we will do that as soon as vaccines are available and we can deploy them. We expect to start with the healthcare workers by the end of this week, as soon as the vaccines come. Obviously, the staff are tremendous in this. So this is serious. There's no sugarcoating this. We still have a ways to go. We've got the holidays. We have to stay vigilant now more than ever. We're going to beat this, but we have to do it together. There is hope. Vaccines are coming. We're excited to be able to start this, and it will make a difference in where we are as a community. But I always go back to our healthcare heroes. They perform miracles every day, but they can't perform magic. They can take care of every single person in this county as best as we can, no matter where we see them. But we need everybody's cooperation and support to do the 3 Ws, to take care of ourselves so that we can take care of our community. Thank you for the opportunity, and again, thank you for the leadership of Washington County. Earl.
Okay, do we have any questions? Oh,
It's like the press conference where you call on the 15 people jumping up.
sure.
Actually, my first question would be for Mr. Joshi. Is that working out better? Oh, it's a one-directional mic. Not to put too fine a grain on this thing, but what does this? What does it capacity mean? I mean, at what point do you have to call in somebody from other counties, or at what point do you have to start sending patients to someplace else or making some other, there's probably no magic number, but can you give us a hint of how close we are or where we will be?
Yeah, great question. So we have triggers at every level, a trigger for the ICU, a trigger for med-surg, and a trigger for overall census. To date, we've been hovering around 80% occupancy overall, so we still have some room there. COVID, obviously, I would say we're near our trigger at near 100, but we're able to continue on. ICU, our trigger, we've been hovering over 90%. So that's probably our most vulnerable trigger. As you can guess, one of the most challenging areas, the highest challenges to recruit ICU nurses. But just yesterday, we had a dozen agency nurses come to our organization, and we are constantly recruiting. So we're near these triggers, but at this stage, we're able to take care of the community. Unfortunately, these things can change in a shift. As you know, if you get an influx of 3 or 4 at one time, it makes it challenging. So we're very concerned about that because we have no interest in sending people out of our community. But it's going to take all of us to make sure that that happens right, because we need the staff and we need everybody following the 3 Ws.
I guess the next one would be for Earl. Sorry. Can you talk a little bit, as I understand it, and correct me if I'm wrong, as I understand it, some of the vaccines will come to the hospital and some will come to the Department of Health.
The first vaccines are going to be coming to the hospital, such as the 975 that will be coming. The health department probably won't get any until at the earliest, maybe at the earliest, the end of next week or even the week after.
Okay. So how will that work for the nursing home staff and residents? Will
The nursing homes are part of a federal program. The feds basically enlisted CVS and Walgreens to do the vaccinations in long-term care facilities. So they, in collaboration with each state. So the Maryland Department of Health is working with CVS and Walgreens to roll out a vaccination in nursing homes, which is probably going to begin within the next 2 weeks. There was basically a 2-week sort of heads up that the states have to give to the feds in order to get the ball rolling on that. So we won't be doing those. they will be handled by the pharmacies.
Great, thank you, I appreciate that.
You're welcome.
And I don't know if Mr. Downey wants to talk or if Mr. Klein is still here, but I do have one quick county question. If I heard correctly at the commissioners' meeting today, the county's not announcing any more restrictions or guidelines in concerning businesses or any of that sort of thing. Is that right? Did I hear that correctly today?
That's correct. The county is taking no local action to restrict business activity. However, it is recommending to all citizens that they act with wisdom and precaution. They are safest at home. When they can't be home, they should maintain their distance and wear a mask and wash their hands. We understand that daily life requires levels of economic activity, and people will be out and about, especially during the holiday shopping season. We just would ask that they be cognizant of the health environment and that they take those actions appropriate to protect themselves and others.
Thank you, I
Thank you.
appreciate that. Thank you.
Thank you very much. That concludes the conference.